This is a basic chair-based exercise session you can do with residents in care homes and nursing homes. You really need to look at the video that goes before this on doing some sort of risk assessment before you do anything with anybody in the way of exercise, but particularly with special populations, which elderly people are. In my experience, I've found that even those into the mid-stages of dementia can do this session fairly easily. So I start at the fingers. I'm going to move the fingers 4 or 5 times. Now the movement I'm showing you here is the easiest movement to catch the attention of even those with dementia. Something a little bit more complicated and functional is a fine touch movement. And again, you repeat that 4 or 5 times. Start off with the fist clench, and then if they get that, go across to the fine touch. Wrists will either roll or they'll go up and down. Normally I start with a roll, and that tends to work fairly well. If they can't get that, then I go to the up and down. As generally in life, elbows and shoulders work together. So I tend to use them in a movement together, and you can see I'm in a chair here, which is something similar to what you find in most care homes. So I might start with a circling movement and bring that back the other way 4 or 5 times, and then maybe an up and an over. Perhaps a breaststroke movement. A forward crawl movement, ringing a bell, chopping wood, climbing a ladder, hanging washing out. The movements you can do are endless. It's just an example about how far your imagination can go, but that takes the elbows and shoulders together. Then we come up to the neck, and you need to think of a Union Jack flag with a horseshoe on it. So you can move the head up and down, side to side, down at an angle, up at an angle. And if you think about the horseshoe, you don't tend to roll across the top. If someone says they feel dizzy or it makes them that it causes pain in the back of the neck, don't do the movement. It's not do or die on any of this, so you can leave it out. If we come down, this part of the back doesn't move so readily. What does move is the lower back. So an easy way to get them to move forward is ask them if they can touch their knees. Most people can touch their knees. If they do that, you ask them can they touch their shins. If they can do that, you ask them if they can touch their shoes, and then back up again. So now you're using the lower back in the movement that mimics getting out of a chair. So there's a functionality to it. The other way the back moves is a round and circular movement. So I can do that with a canoeing movement, a skiing movement, riding a horse, a simple rotation of the back. So the final movement is a reach down to the floor. So again, I'm coming slightly forward into the front of the chair. Again, it's a functional movement. I can do that 5 times on one side, 5 times on the other, as you just saw me do it alternatively on each side. When we get to the hips, the easiest movement is a marching movement, and that lubricates the ball and socket of the hip joint. Then we get to the knees. Now the knees will only work in one plane of movement, so it's just a simple up. The golden rule is you always have 1 foot on the floor. So again, I can do 5 on one leg, 5 on the other, or I can alternate it. Finally, we get down towards the ankles, and you've got a rolling movement which repeats what we've done on the wrist, and a back and forward movement. If you want, you can do the toes as well. So I used to do like a clenching on the floor. So most people are in slippers, so they'd be clenching through onto the floor through the slippers. That is a basic seated exercise session. It's a mobilisation session, so you can run it on its own, or you can run it as part of the other sessions that we're going to follow on with. It should take you anywhere between about 5 minutes and up to about 20, depending on the group of people you've got with you. I hope that's helpful, and have a look at the next video along.